What was interesting was also that we tried to see, we had 42 patients who had frozen tumors as well, and we had 59 patients. It was a mix of frozen and paraffin blocks, and we tried to see whether there's a good correlation, and gratifyingly, there was an excellent correlation between what we could do on microRNA on paraffin blocks as compared to the frozen tumor, which gives a kind of confidence that you could do on paraffin blocks. But more interestingly, perhaps, we also tried to look at the Heidelberg group, and except one patient, there was an excellent concordance. So our conclusions were that microRNA-based real-time PCR is relatively rapid, simple, inexpensive, and useful for molecular classification, risk stratification for medulloblastoma. So we do it now as a routine practice, and we can do it for any of you if you can send us a little clinical annotation and a paraffin block. We'll be very happy to do a molecular profile for all of your patients and send the reports as well. And those patients who are unaffording, cannot afford, we'll be very happy to do free of charge as well if the patient deserves that way. Interestingly, the subtypes of medulloblastoma was very fascinating that the Wnt pathway seemed to be in the central, arising from the dorsal brainstem, while the sonic hedgehog was on the side, on the lateralized from the neuron precursor cell, from the granule neuron precursor cell. And there is a fascinating data that could you predict medulloblastoma molecular subtype based on an MRI scan? And there are 2 or 3 papers already. One is from Baylor as well, and one is from Toronto. So we have an ongoing TMH study where we found out, based on sample size calculation, we identified 36 MRI criteria within 13 main criteria, and we did 130 patients to have some kind of a prospective model to identify what is the molecular subtype. And it's a routine in our joint neuro-oncology tumor boards as to what could be the possible molecular subtype. We have accrued 52 patients so far, and just a snapshot of Wnt pathway, for example, the fourth ventricle seems to be completely obliterated. Hydrocephalus is sometimes present because it is a central tumor. There has to be the classic hallmark is the cystic area is almost like a sieve. So when you see this kind of a sieve-like, we tend to believe that there's a Wnt pathway and there's moderate uniform enhancement. Sonic hedgehog can be lateralized, but that can be central as well, especially in infants. Group D tend to be inferior. They almost look like ependymomas when they have the inferior extension to the C1 and C2. And group C, surprisingly, are actually relatively non-enhancing. You would expect them to be the most malignant and most enhancing. So we are collecting the data prospectively. In a year or two, we hopefully should get a prospective model as to what you could predict based on the MRI scans.